Because largely, because of my experience looking into the Mid-Staffordshire disaster, hospital disaster with Sir Robert Francis, and spending a year living in Stafford and reading the statements of people who'd been seriously damaged by bad care. I think one of the problems is that patient safety isn't a core topic as it needs to be in the leadership of trusts. I'm sure it's there, and I'm sure the medical director will be aware of it and the nursing director will be aware of it, but it doesn't seem to be a topic that is focused upon. And my own view is that there needs to be a specific focus on patient safety in board meetings, and that ethos, hopefully, should trickle down through the trust. And it's the ethos of the board that really matters. I think, first of all, it would be sensible if there were a director of patient safety, or at least somebody learned in patient safety on every single board. I think also the education and training of non-exec directors could be vastly improved, and I'm hoping that some of my recommendations from the report into the Fit and Proper Person test will assist with that, because there will be core competencies that every director has to meet. The reason that's important is because NEDs are there to challenge. They're there to challenge the board and what's going on in the hospital. If you look at all hospital disasters, whether it's Mid-Staffs or Liverpool or wherever you want to look, the lack of challenge on the board was absolutely critical. So I think you need to empower NEDs by training to help them to challenge what's going on if it's going wrong in hospitals. I think it's a great idea. I think one of the big problems in the NHS is the lack of dissemination of good learning. And if the hub works as I understand it's intended to do, it won't just be a talking shop, it will be an information tool that anybody is able to patch into, as it were, and see what's gone wrong elsewhere and how's it been cured. And the dissemination of information, the communication of good practice and good learning is absolutely critical. And one of the problems, of course, is you've got, however many it is, 220 individual trusts, and they need to learn from each other rather than be individual businesses doing their own thing. So I think the hub could really help that.